preparation and to ensure the preparation or contain microorganisms. Nowadays, sterilization technology is becoming important since variety of sterile materials are required for healthcare departments. So, pharmacists must understand clearly various terms related to sterility. तो स्टरलिटी से रिलेटेड वेरियस टर्म्स कौन कौन सी हैं? एक है स्टरलिटी, दूसरी आ गई स्टरलाइजेशन, थर्ड इज एंटीसेप्टिक, फोर इज डिसइंफेक्शन, फिफ्थ इज बैक्टीरिसाइड, नेक्स्ट बैक्टीरियोस्टैटिक, नेक्स्ट वीरिसाइड एंड लास्ट वन इज जर्मीसाइड. सो हम वन बाय वन हर टर्म के बारे में पढ़ेंगे ताकि आपको डीप नॉलेज मिले. सो स्टरलिटी जो है दैट इज एब्सेंस ऑफ वियाबल माइक्रो ऑर्गेनिजम्स. और स्टरलाइजेशन क्या होती है? प्रोसेस बाय विच ऑल द वियाबल फॉर्म्स ऑफ माइक्रो आर रिमूव्ड और डिस्ट्रॉयड. एंड नंबर थर्ड है डिसइंफेक्शन. ये होती है अ प्रोसेस that removes infection by destroying microorganisms. This term is usually used for inanimate objects. Next is bactericide. That is any substance that kills bacteria. मतलब इसमें फर्क है कि ये kills करता है, साइड लगा है ना, बैक्टीरिसाइड मतलब kills बैक्टीरिया. बैक्टीरियोस्टैटिक मतलब रिटार्ड्स, ये रोकेगा. A substance which retards the growth of bacteria, रोकेगा. Static. And viricide, a substance which kills virus. Germicide, a substance that kills disease causing microorganisms but not necessarily bacterial spores. ये माइक्रो ऑर्गेनिज्म से रिलेटेड है, ना कि बैक्टीरियल स्पोर्स से. तो जर्मिसाइड मतलब ए सब्सटेंस दैट किल्स डिसीज काउजिंग माइक्रो ऑर्गेनिजम्स. उन माइक्रो ऑर्गेनिज्म को ये किल्स करेगा जो कि डिसीज काउजिंग है बट नॉट नेसेसरली द बैक्टीरियल स्पोर्स. अब है कि टाइप्स ऑफ मटेरियल्स फॉर स्टरलाइजेशन. स्टरलाइजेशन के लिए कौन कौन से मटेरियल्स की टाइप्स होती हैं? Although in hospitals for various economic reasons containers are not critically examined, but it is the duty of the pharmacist to be fully aware of containers, closures and materials for sterilization. Although in hospitals for various economic reasons containers जो होते हैं are not critically examined, but it is the duty of pharmacist to be fully aware of containers, closures and materials for sterilization. Essential features of ideal containers: it should not affect the content. जो हमारे कंटेनर हैं वो इफेक्ट ना करें जो हमारा कंटेंट है उसको. नेक्स्ट, it should be strong enough to withstand the changes of temperature and pressure. It should be strong enough to withstand the changes of temperature and pressure. Next, it should be easy to clean and maintain. It should protect the content from harmful light radiations. It should be transparent and colorless. अब आ गया हमारा मटेरियल्स फॉर कंटेनर्स. कंटेनर्स के लिए कौन कौन सा मटेरियल होता है? नंबर 1 ग्लास, सेकंड इज प्लास्टिक. प्लास्टिक में दो आते हैं, एक थर्मोप्लास्टिक, एक थर्मोसेटिंग. ठीक है, तो अब आ गया हमारा है कि मटेरियल फॉर कंटेनर्स में ग्लास में आते हैं हमारे लाइम सोडा ग्लास, बोरोसिलिकेट ग्लास, न्यूट्रल ग्लास, न्यूट्रल ट्यूबिंग एंड फॉर एम्प्यूल्स, लेड फ्री ग्लास, सल्फर्ड कंटेनर्स, सिलिकॉन ट्रीटेड कंटेनर्स. ठीक है, नाउ नेक्स्ट है हमारे प्लास्टिक। प्लास्टिक में हमारे दो हैं, एक थर्मोप्लास्टिक है, एक थर्मोसेटिंग टाइप है। जो थर्मोप्लास्टिक टाइप है वो है पॉलीइथाइलीन, हाई डेंसिटी पॉलीथीन, पॉलीविनाइल क्लोराइड जिसे हम पीवीसी कहते हैं, पॉलीमिथाइल मेथाक्राइलेट, पीएमएमए, पॉलीस्टाइरीन, पॉलीटेट्राफ्लोरोइथाइलीन, पॉलीप्रोपाइलीन, पॉली पॉलीअमाइड्स और पॉलीकार्बोनेट। नेक्स्ट आ गया हमारा थर्मोसेटिंग टाइप। फिनोल फॉर्मेल्डिहाइड, यूरिया फॉर्मेल्डिहाइड एंड मेलामाइन फॉर्मेल्डिहाइड। थर्मोसेटिंग में थ्री टाइप्स ही हैं हमारे। अब आ गया हमारा मटेरियल फॉर क्लोजर्स के लिए। तो क्लोजर के लिए कौन सा, एक होता है नेचुरल रबड़, एक होता है हमारा सिंथेटिक रबड़। तो जो हमारा है नेचुरल रबड़ वो होती है हमारी स्मोक्ड शीट और पेल क्रेप। एंड नेक्स्ट है हमारा सिंथेटिक रबड़, उसमें आता है हमारा ब्यूटाइल रबड़, नाइट्राइल रबड़, क्लोरोप्रीन रबड़ एंड सिलिकॉन रबड़। नेक्स्ट आ गया हमारा स्टरलाइजेशन मेथड्स फॉर डिफरेंट मेथड। स्टरलाइजेशन मेथड्स फॉर डिफरेंट मटेरियल्स। अलग अलग मटेरियल के लिए कौन सा स्टरलाइजेशन मेथड यूज होता है, बहुत ही इंपॉर्टेंट है। As variety of materials are used in hospitals for which sterilization is an essential condition, there are different methods which are widely applied to such material and pharmaceutical preparations. These include heat, filtration, ionization, radiation methods, etc. So, number one है glass apparatus and containers. Generally, dry heat sterilization method is preferred as against moist heat sterilization because post sterilization drying at a temperature of 65 degrees Celsius is necessary in case of moist heat sterilization. The glass apparatus is first heat disassembled and openings loosely plugged with non-absorbent cotton wool or protected with paper cap. Loading should be done in such a manner that it will encourage quick air drainage. Number two, closers. Dry heat sterilization method is used for loosely fitted metal caps, whereas thermostable plastic screw caps lined with rubber and rubber closer for multi-dose containers are sterilized by autoclaving. Caps should be wrapped in paper and arranged in a single layer to minimize trapping of air. Number three, injection solution and suspension. BP prescribes 115 degree to 116 degree for 30 minutes for sterilization by autoclaving, but allows a shorter time and a higher temperature condition, that is 121 degree Celsius for 15 minutes. ये MCQ में बहुत बार पूछा जाता है. If the medicament is thermostable, majority of the injections containing thermostable drugs are sterilized by autoclaving. Number 4, surgical dressing and fabrics. Number of materials are used in surgery for treatment of wound and infections. Materials like cotton wool, balls, gauze swabs, ribbon, gauze, bandage, operating gowns, caps, masks, towels, and rubber sheets. Trolley clothes require special surgical dressing sterilizers. Dressing are located very carefully to chambers. Air is removed completely and dry saturated steam is passed and after a specified period, supply of steam is cut off and dressing are dried by drawing high vacuum से. नंबर 5 है हमारे पाउडर्स एंड ऑयली व्हीकल्स. Powder vehicles for oily injection, ointment bases, soft paraffin, hard paraffin, wool fat, wool alcohol, beeswax are sterilized by dry heat method. तो ये क्वेश्चन आ सकता है कि पाउडर एंड ऑयली व्हीकल्स को हम कैसे स्टरलाइज करते हैं. तो इनको हम ड्राई हीट मेथड से स्टरलाइज करेंगे. पाउडर्स कैन बी कैटेगराइज्ड इनटू टू मेजर ग्रुप्स. जो हमारे पाउडर्स होते हैं उनके टू मेजर ग्रुप्स हैं, दैट इज मेडिकल एंड सर्जिकल. मेडिकल पाउडर्स आर मेंट फॉर सुपरफिशियल स्किन कंडीशंस. Hence, sterility is not essentially, whereas surgical powder must be sterilized because they are used for various body cavities in major wounds or burns. जो हमारे सुपरफिशियल स्किन इन्फेक्ट कंडीशंस है उनमें उनको स्टरलाइज करने की जरूरत नहीं है, लेकिन जो सर्जरी के दौरान यूज होते हैं उनको करने की जरूरत है, क्योंकि डीप हमारे जख्म डीप होता है तो इनसाइड बॉडी जा सकता है. नेक्स्ट इज थर्मोलेवाइल पाउडर्स. For thermolevyl powders, ethylene oxide gas is used for sterilization. Powder के लिए क्या है मेथड? इथाइलिन ऑक्साइड गैस यूज होती है. इथाइलिन ऑक्साइड गैस फॉर थर्मोलेवाइल पाउडर्स sterilization. Okay, now air. Incoming air or the internal air of the room can be sterilized by UV radiations because they provide air of adequate bacteriological quality. एयर को करेंगे यूवी रेडिएशन से. इंजेक्शंस स्टरलाइजेशन बाय फिल्ट्रेशन मेथड. इंजेक्शंस को हम कैसे करते हैं फिल्टर स्टरलाइज फिल्ट्रेशन मेथड से. मैनी injections are sterilized by filtration method, while as for some others it is an alternative method, for example amitriptyline, gentamicin, heparin and insulin, etc. Now the packing of material. As the article are not used immediately after sterilization, hence precautions are taken to ensure their sterility till they are actually used. Contamination may occur during exposure, and hence some form of packaging is necessary. The type, nature of packaging depend upon whether or not the outside of the article must remain uncontaminated. Various packing material which are used prior to sterilization are enlisted below: paper, fabric, nylon film. पेपर ये हमारी पैकिंग मटेरियल है, इसकी स्टरलाइजेशन के बारे में अब हम बात करेंगे. पेपर. पेपर बैग्स प्रोवाइड flexibility in size and are convenient to use. It should have the following properties. It should provide a barrier against the bacteria. It should be permeable to steam or air. Paper should be of such tensile strength that it can withstand the normal risk of handling. It must have adequate wet strength to withstand steam sterilization. There is a special paper which is water repellent on one side, in which the article can be wrapped before placing in the bags. This repellent surface prevents contamination if the paper becomes wet. Fabrics. An alternative method of packaging is to use suitable fabric of double thickness. It offers instantaneous penetration of steam and is reusable. It keeps them sterile, dry, and free from insect attack. Unbleached calico is better fabric for packing than the muslin cloth because bacterial contamination occurs less readily when calico is used. Next is nylon film. It is available in the form of tubes of various widths. Special sealers can use to make bags of suitable length. Large tubes are used to wrap various parcels of dressings. Although the film is tough but smooth and bacteriologically acceptable in composition appearance, it is permeable to steam but not to bacteria, as air does not escape quickly, hence bursting may occur in high vacuum condition, which can be avoided by keeping one end open. Another advantage of nylon film is that it can be used several times. Nylon film is used several times. Method of packing: to give right protection and the proper sterilization of the content, general principle of packing are followed. The content should be arranged loosely. The space should be adjusted in such a manner that items and the fold should be parallel to each other. The size of pack should be as small as possible. Material like hand towel, tightly woven, and rubber sheet should be sterilized separately in a loose arrangement of packing. Metal drums. Metal drums are lined with a double layer of fabric of sufficient size so as to cover completely, dressing up at the top. The article can be packed parallel to the bottom of the drum. It should be kept in mind that vents at top bottom holes should be clear as far as possible. Number two, cardboard boxes. The contents are wrapped in paper, plastic, fabric first to give extra protection. These items are placed parallel to side of box with spaces between them. Fabric packs. Fabric packs offer extra protective barrier during storage. Their size is zero point 0.3 into zero point 0.3 into zero point 0.5 m, which is generally accepted. It should not be too large before wrapping in outer double layer of fabric. It is always advisable to wrap the item in a towel cloth or paper to serve as a sterile working surface when the items are in use. And now next is nylon bags. For using nylon bags as a packaging, it should be kept in mind to keep as much as possible air to be pressed out before sealing. Air to be pressed out before sealing. Paper bags. An inner wrapping of paper, for example, crepe, is always used for items to give protection to the paper bags. Now, the sterilization equipments. For sterilization of products, materials, various methods of sterilization are used. These can be classified as under physical method, chemical method, and mechanical method. Physical method में हमारे होते हैं three: dry heat sterilization by radiation. ये कौन से हैं हमारे physical method. Chemical में आ गया हमारा gases reactants. Number three is जो कि हमारे इंजेक्शन होते हैं. पढ़ेंगे dry heat sterilization. For sterilization of injectables, needles, syringes. Injectables, injection नहीं है, injectables है. Needles and syringes. Glass apparatus such as flasks, pipettes, bottle, beakers, and test tubes are sterilized by this method. Their mouth is plugged with non-absorbent cotton wool. Generally, metallic instruments like scalpels, scissors, knives, spatula, blades are sterilized by dry heat sterilization method as it is less damaging than moist heat. मॉइस्ट हीट ज्यादा डैमेज करती है, ड्राई वाली कम करती है. ड्रग्स विच आर स्टेबल at 150 degrees Celsius and thermostable. 5 number है, the equipment used for aseptic processing such as the mortars, pestles, tiles, etc. are conveniently sterilized by this method. Next, this method is of particular value in case of oily injections, ointment based powder, pharmaceutical, lubricants, etc. ये हॉट एयर ओवन है. इसमें यहाँ वेंट है ऊपर लगा, आउटर केस कंटेनिंग ग्लास फाइबर है, इसमें फैन लगा हुआ है, एस्बेस्टोस गैस्केट्स हैं, ये रेगुलेटर्स लगे हैं, परफोरेटर शेल्फ्स है. Sterilization by dry heat is usually carried out in an apparatus known as hot air oven. It is metallic chamber made up of steel or aluminium separated from outer case by a thick layer of glass fiber insulation. ये glass fiber insulation glass. This door is double walled and inner side has asbestos gaskets. ये asbestos gaskets हैं इसके अंदर, which makes it airtight and prevents heat loss. Heat is transferred from source to articles in hot air oven by conduction, convection, and radiation. A thermometer is fitted in front of oven to note down the temperature during sterilization. Hot air oven should satisfy the following requirements. Every item inside the oven must receive correct exposure of heat. The temperature of sterilization must be attained quickly and be maintained with the little radiations. At the top of oven there is a ventilator and on the bottom there is a chamber in which heating elements are fitted. इसकी वर्किंग कैसे हम इसकी वर्किंग के बारे में पढ़ेंगे हम. During sterilization, the material to be sterilized is placed in oven properly and the door is closed. Extra time is always allowed to penetrate heat into the material. The temperature is the ventilator is allowed to remain open 15 डिग्री सेल्सियस तब तक हम वेंटिलेटर को ओपन रखते हैं. कंटेनर्स मटेरियल टू बी स्टरलाइज्ड. क्यों ओपन रखते हैं हम वेंटिलेटर को? ताकि जो हमारा मॉइस्चर है वो 115 डिग्री सेल्सियस, द वेंटिलेटर इज क्लोज्ड. जैसे ही 115 हो गया तो हमने वेंटिलेटर को क्लोज कर देना है. एंड द ओवन टेम्परेचर इज अलाउड टू राइज अप टू 150 डिग्री सेल्सियस. और फिर हम इसका टेम्परेचर को इंक्रीज करेंगे 150 डिग्री सेल्सियस तक. The heat is transferred from the source mainly by radiation and convection. After 1 hour, the oven is switched off and allowed to cool to about 60 degrees Celsius. During dry heat sterilization, all the living microorganisms and their spores get destroyed due to oxidation or protein present in the living cells. Although heating at 250 degrees Celsius can destroy all types of microorganisms and their spores, but this can spoil the product also. Hence, dry heat sterilization at a temperature of 150 degree to 160 degree Celsius gives most satisfactory results. ऑब्वियस है कि अगर हम 250 कर देंगे तो सब डिस्ट्रॉयड हो जाएगा, लेकिन हमारा जो मटेरियल है वो भी हो जाएगा डिस्ट्रॉय, तो इसका कोई बेनिफिट नहीं हो. प्रिकॉशंस क्या लेनी है? Overloading should be avoided. There should be sufficient space between the articles to provide uniform distribution of heat. To prevent breakage of glass apparatus, it should be kept in mind to cool down the oven temperature. Opening of glass items should be plugged with non-absorbent cotton wool and wrapped further in a paper. Limitation क्या है? This method cannot be used for thermolevile medicaments, rubber and plastic के लिए हम use नहीं कर सकते. It is unsuitable for surgical dressing because it destroys natural moisture of fiber and makes them brittle and discolored. तो ये इसकी limitation है. Now next है moist heat sterilization. Microorganism can be killed using hot water, boiling water, steam at atmospheric pressure, steaming, and steam under reduced pressure, autoclaving. Moist heat sterilization is more powerful than dry heat sterilization, as penetration power of steam is more as compared to dry heat. Thermal capacity of steam is much greater than the thermal capacity of dry heat. During moist heat sterilization, microorganisms are killed due to the coagulation and denaturation of proteins present in living cell or microorganism, and the coagulation occurs at a lower temperature due to the presence of moisture. Moist heat sterilization can be categorized under the following subheads. Moist heat में क्या क्या आता है हमारा? Autoclaving, heating with bactericide, electric boiling water sterilizer, heating with boiling water, टेंडलाइजेशन एंड पास्चराइजेशन. ये सारे जो मेथड्स हैं ये हमारे हैं मॉइस्ट हीट के. हमारा मिल्क जो है हम करते हैं पेस्चराइजेशन से. ये सारे मॉइस्ट हीट में आते हैं स्टरलाइजेशन मेथड में. तो इसके अंदर क्या होता है? ये है ऑटोक्लेव में हमारा स्टीम वेंट होता है, प्रेशर गाउज लगा हुआ है, ये सेफ्टी वाल्व होता है, ये विंग नट है, परफोरेटर बास्केट्स है, ये इसको हम ऑटोक्लेव बोलते हैं. तो अब आया हमारे एप्लीकेशन एंड यूज. दिस मेथड इज यूज्ड फॉर स्टरलाइजेशन ऑफ ग्लास अपरेटस कंटेनर 115 डिग्री सेल्सियस फॉर 30 मिनट. 115 है तो 30 मिनट होता है और 121 हो तो 15 मिनट होता है. प्लास्टिक स्क्रू कैप्स, रबर लाइनर्स, क्लोजर, रबर ग्लव्स मस्ट बी ऑटोक्लेव्ड. इसमें सब कुछ कर देंगे हम ऑटोक्लेव. It is suitable method of sterilization for injectable solution except oily injection with and suspensions. वो नहीं होंगे. Surgical dressing can be autoclaved for sterilization. Apparatus and working. Autoclave is a strong cylindrical chamber made up of एल्यूमिनियम अलॉय स्टेनलेस स्टील का बना होता है. हमारा ऑटोक्लेव किससे बना है? Autoclave is a strong cylindrical chamber है made up of aluminium alloy stainless steel. On its lid there are various controls. जैसे हमने देखा था उसमें steam vent था, safety valve है, pressure gauge है. तो on its lid there are various controls like steam vent, pressure gauge, safety valve and sometimes thermometer भी लगा होता है. Inner side of the lid has a rubber gasket होती है which makes it airtight. जैसे कुकर में गैस्केट होती है जिसकी वजह से टाइट होता है ना, वैसे ही इसमें भी एक रबर की गैस्केट होती है. टू कीप इट्स कवर इन अ पोजीशन इट इज प्रोवाइडेड विद विंग नट एंड बोल्ट्स इनसाइड द चैम्बर. देयर इज अ परफोरेटेड मेटालिक basket or wire containing in which the material to be sterilized is packed inside, and a gasket in which electrically heated elements are fitted. The perforated metallic chamber is removed out and water is put to level so that it does not touch the bottom of perforated chamber. The material to be sterilized is loosely packed so as to leave space for expansion and prevent breakages, and then it is placed into the chamber. Caps of bottle fluid should be screwed down tightly so that there is no danger of explosion, as the internal pressure are approximately balanced by steam pressure outside. The lid is put in position with the help of wings, nuts and bolts. The vent is opened. Autoclave is switched on and the water is allowed to boil. बेंट हो गया, जैसे प्रेशर कुकर के ऊपर सीटी होती है वैसे इसका बेंट होता है, उसको ओपन रखना है जब तक पानी गर्म ना हो जाए. The steam is allowed to pass freely from the vent for 5 minutes. 5 मिनट के लिए हम इसकी स्टीम को निकलने देते हैं. और ड्राई हीट में क्या था, हमने पढ़ा था कि ड्राई हीट में हम उसको जब तक 115 डिग्री सेल्सियस टेम्परेचर मेंटेन नहीं होता तब तक हम उसको ओपन रखते हैं. उसके बाद हम उसको टाइट कर देते हैं, बंद कर देते हैं. When whole of the air is removed, इसमें 5 मिनट में सारी एयर निकल जाएगी. Steam vent is closed. फिर हम steam vent को close कर देंगे and pressure is allowed to rise up by 10 pounds per square inch. BP allows exposure of whole of the content to 115 डिग्री सेल्सियस to 116 डिग्री सेल्सियस for 30 मिनट्स के लिए. Then the autoclave is switched off and is allowed to cool until the pressure falls to zero. जब तक प्रेशर जीरो नहीं होगा हम उसे ओपन नहीं करेंगे. Now the vent can be opened. Otherwise, if the internal pressure is high, it may lead to vigorous boiling and bursting of sealed bottle and ampoules. The sterilization material should be carefully collected by opening the lid. इसका प्रिंसिपल क्या है? Principle and temperature conditions. During moist heat sterilization, the material are sterilized by saturated steam at a pressure higher than atmospheric pressure. The time required for sterilization of method is inversely proportional to steam. The table shows varying time, temperature, pressure of saturated steam in an autoclave. ये है टेबल. Moist heat sterilization on a small scale can be done by using pressure cookers. वाओ, ये तो वही बात आ गई. स्मॉल स्केल में करना हो तो प्रेशर कुकर में भी कर सकते हैं. लिमिटेशन क्या है? दिस मेथड कैन नॉट बी यूज्ड फॉर थर्मोलेवाइल सब्सटेंस के लिए ये मेथड यूज नहीं होगा. अब है हीटिंग विद बैक्टीरिसाइड. साइड मतलब जो किल कर देता है. हीट करना है जो बैक्टीरिया को साइड को मतलब मार देगा. This method is useful for relatively heat sensitive substances which are stable at about 100 degrees Celsius. The bactericide presence reduces the sterilization temperature. जो बैक्टीरियासाइड है जिसकी वजह से जो टेम्परेचर है स्टरलाइजेशन वो कम हो जाता है. एजेंट्स लाइक क्लोरो cresol 0.2% and phenyl mercuric nitrite are used and is requires heating at 98 degrees Celsius to 100 for 30 minutes only. Apparatus. A covered beaker. A beaker, covered beaker. इसके अंदर ये bactericide होगा. Heating is carried out in a beaker by immersing the article in boiling water. Heating is carried out in a beaker by immersing the article in boiling water. Top of the beaker is covered to maintain steam around the container. इसको cover करेंगे. Next is steamer. Steamers are cylindrical vessels having a basket inside as in an autoclave. About 5 centimeters of water is put inside and material to be sterilized is placed in the basket. The apparatus is heated to keep water boiling. The lid is always kept closed for steaming. Electric boiling water sterilization. It is useful for large batches of injections. It has an autonomic system of closing the lid as the tray is lowered inside and keeps the water boiling. It is an official method फॉर थर्मोलेवाइल मेडिकामेंट. ये पहले वाले जो थे वो थर्मोलेवाइल के लिए नहीं थे, लेकिन इलेक्ट्रिक बॉइलिंग वाटर स्टरलाइजर जो है ये थर्मोलेवाइल के लिए भी यूज हो रहे हैं, because it offers low temperature as compared to autoclaves. Another advantage over autoclave is that it is inexpensive and simple to operate. इसकी लिमिटेशन क्या है? We cannot use it for oily solution or suspension. Similarly, it can be used for solution or suspension of medicament unstable at 98 degrees Celsius to 100 degrees Celsius. Heating with boiling water. This method can kill vegetative organisms within 2 to 3 minutes and is used for various instruments. Water is boiled in a vessel or using electric boiling sterilizer and is covered properly with a lid. Heating with boiling water. But इसकी वजह से क्या हुआ? It may lead to many undesirable effects like decomposition, alteration in color, texture, potency, solubility. Advantages. Advantage, as the sterilization time is very small, hence it is continuous process. This method is reliable for bacterial and viral vaccine. Rise in temperature is negligible. Dry, moist and frozen material can be sterilized. As sterilization is done after final packing in container, hence aseptic handling is not required. Disadvantage, investment cost for the plant is very high. To prevent deleterious effects and hazards, elaborate and expensive precautions are taken. This process, once started, cannot be controlled until whole of the radioactive isotope is used. Infrared radiations. Infrared radiation destroy microorganisms by heat produced after their absorption in the material. Hence, they are also known as thermal radiation. Since the energy is converted into the heat energy, sterilization by IR radiation is done in conveyor O1, which consists of an insulated tunnel through which a metallic conveyor belt passes. IR radiations are contained from IR element which are fitted in the tunnel above the conveyor belt. This process involves the material to be sterilized or to be kept in trays, and these trays are placed on the conveyor belt. In this process, the material is sterilized in 20 minutes at about 180 degrees Celsius. Application and use. It is suitable method for heat sensitive material. It is used for sterilization of glass containers, bottles, glass apparatus, aluminium caps. Sterilization time is very short and temperature rises very fast.